Hey, this is Dr. Lane Harris, dental surgeon and implantologist at Restore24. I'm just going to talk to you a little bit about post-operative care to ensure a successful outcome of dental implant procedures. So important things for patients to keep in mind for the first 24 hours after surgery are how to manage your pain and how to manage the healing site where treatment was provided. Whenever we provide surgery, there's minimal trauma to the tissue, and it's important to be kind to that tissue as it heals. Some good tips are to not put your hands in your mouth and not to do things that would move around that tissue that's trying to close. Some other excellent ideas to practice during the healing phase right after implant surgery are the use of ice packs to minimize swelling, in addition to prescription medications that will help reduce the amount of swelling that you'll experience as prescribed by your doctor. Immediately after you've had a dental implant surgery, you might have a little bit of swelling or a little bit of discomfort. It's important to get some pain medication in your system as quickly as possible, so before your tissues and your body wakes back up and your nerves start to let you know that they experienced a little bit of trauma, your pain medication is already doing its job managing any discomfort that you would experience. So as your pain medication is in your system, before the numbing wears off, you do not experience a window of discomfort. That's a very helpful tip. So it's ideal to pick up your prescription medications and have everything prepared from a pharmaceutical standpoint before you have your procedure done. For the long-term success of dental implants, it's really important for the patient to understand what contributes to implant health. Once the implant has healed into the bone, rather the bone has healed around the implant, there's really not a lot of change or effect to the health of that implant, and it will pretty much stay a part of your body indefinitely. When you start to experience problems that can influence the slow process of implant failure, that usually is related to the tissue health, meaning the gums. An adage we like to use in dentistry and implantology is that tissue is the issue and bone sets the tone. So bone sets the tone is referring to the quality of the bone when the implant is placed. And again, once it's healed, we're good. Bone's not an issue. It's really a matter of the gums. So it's important to ensure that the implant is placed in an area that has an appropriate quality of tissue as well. And what I mean by that is that we have keratinized tissue, which is that lighter pink fibrous tissue around your teeth. That type of fibrous tissue will protect any movement and prevent that tissue recession around that part of the implant that is sticking out of the tissue, holding onto your prosthesis. As long as you have good tissue quality around the prosthetic component attached to the implant will last a very long time. However, if you experience inflammation in that tissue due to food debris accumulation or plaque, that's when you also start to see a slow process that can also cause bone loss around the top of that implant and around the attachment. From a patient's perspective, it's really important to just make sure that their mouth is clean and that there's no food accumulation around the gums that are around the implant. As long as a patient does a really good job making sure that their mouth stays clean and the oral bacteria is kept at a healthy level, they should not experience inflammation that would otherwise contribute to bone loss. In other words, if your mouth is clean, your implant should last a very, 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 very long time. How do we keep a clean mouth? Keeping a clean mouth really means use of a water pick and use of a toothbrush to make sure that we don't have accumulation of food debris. It's a pretty simple procedure and just requires a little bit of attention and purpose to it. And as long as you intend to keep your mouth clean, it's a pretty good chance that it'll stay clean, your gums will be happy, and the implants will last for a very long time. And whatever prosthesis is attached to those implants will serve its purpose. And there should be a very low risk and a very low concern of those implants having any complications in the future. Outside of oral hygiene, a couple other things that are really damaging to dental implant health. And again, when I say dental implant health, I'm specifically referring to the tissue in the mouth, which is going to protect the bone underneath the tissue. Our overall general health can also affect the health of our mouth, just like the health of our mouth can affect other parts of our bodies. One thing that is very important for our oral health is the control of systemic diseases such as diabetes. There are not a lot of things that can cause significant harm to dental implants. The two things that cause the most harm to dental implants are uncontrolled diabetes and heavy smoking. As we smoke, it causes our blood vessels inside the gums and inside the skin in our mouth to shrivel up, which sort of cuts off the nutrient supply that would otherwise be provided to that tissue through the blood vessels. When that nutrient supply is cut off, the health of that tissue starts to also lag, and we can start to see inflammation and a lack of health and a lack of the body's ability to repair and regenerate and maintain its health. Uncontrolled diabetes is also another disease process that increases inflammation that can cause your gums to become irritated and can cause bone remodeling and bone loss around the implants. So outside of staying healthy and keeping your mouth clean, there's really not a lot to worry about to maintain the long-term use of your dental implants and thereby the prosthetic that allows you to chew and smile that is attached to and supported by those implants.